Hi everyone, I'm Dr. Genevieve Newton, the Scientific Director of Fringe. Thank you for joining me today to learn about Fringe's vitamin D and K mix. So this presentation is going to be broken up into two parts. The first part, we're going to do an overview of vitamin D and K. We have to talk about the basics, where to get them, forms, biological roles, what happens when you're deficient, what happens when you supplement, and how do these two vitamins work in synergy. And then in the second part, we're going to talk about why we're going to take Fringe vitamin D and K mix in order to deal with our issue of deficiency. We'll talk about our active ingredients, our inactive ingredients, noteworthy characteristics of Fringe's supplement, the existing market, how we do our safety testing, and then last but not least, how to use vitamin D and K from Fringe. So let's get started. The first thing we have to talk about are just some basics about what are vitamins. So vitamins are micronutrients. All that means is that they're nutrients that we need in really teeny tiny amounts. They can either be classified as fat-soluble or water-soluble, and vitamin D and K are fat-soluble. Why this matters is that fat-soluble vitamins are actually a little bit tricky to absorb. We need fats in the GI system in order to actually absorb those effectively. And when we don't have these optimal conditions, we really decrease the bioavailability of the nutrients. And what that means is that less of the nutrients get to our tissues than we ideally want to have happen. This is in contrast to water-soluble vitamins. They're really easily absorbed. They're also really easily excreted. So just for now, understand that vitamin D and K are fat-soluble vitamins, but water-soluble vitamins are better absorbed. Okay, so that sets some groundwork for us. Now let's talk about the vitamins specifically. Where do we get vitamin D? We have three sources. So 1 is from food, 2 is from sun, and 3 is from supplements. The vitamin D sources of food that are natural are actually really, really limited. Historically, evolutionary speaking, we don't have a lot of natural food sources of vitamin D. So we've got fatty fish. The form in here is vitamin D3. We have egg yolks, also vitamin D3. Mushrooms, which are vitamin D2. Beef liver, trace amounts there, vitamin D3, and then we have really small amounts in some cheeses, naturally occurring. Some cheeses also have fortified vitamin D, which we'll talk about next. But the point here is that there really isn't a lot of vitamin D that naturally comes from food. That's because we have another route of historical evolutionary exposure that we're going to talk about. But we also have this dietary route that is fortified foods. So what fortified foods are is a food that doesn't naturally contain that nutrient, but which has the nutrient that has been added to it. And the governments, many governments around the world, have deemed vitamin D such an important nutrient that is present naturally in such low amounts in our diet that they recommend, or actually mandate in some cases, that we need to add it to some certain foods in our food supply, just to increase the intake in the population. So the foods that are fortified often with vitamin D are milk, plant-based milks, fortified orange juice, some breakfast cereals, margarine and some butter substitutes, and then some yogurts. Now, in terms of the form that's going to be in those, it'll be either vitamin D2 or vitamin D3, depending on the food, and we'll get into the details of what those differences are in just a moment. Vitamin D from supplements is either going to be this vitamin D3 form or vitamin D2. So here's how these are different. Vitamin D3 is found in animal foods. Vitamin D2 is found in plant foods and fungi. Vitamin D3 is more efficient at raising vitamin D levels in our blood. Vitamin D2 is less efficient. And so for this reason, most doctors, naturopaths, healthcare professionals, nutritional scientists recommend that whenever possible, you take vitamin D3 because it's more bioavailable than vitamin D2. And what bioavailability means is that what you take in your mouth goes through your GI system, actually gets to the tissues distributed throughout your body, and does what you want it to do. So as a point here, 18.5% of US adults take a vitamin D supplement. This is actually a lot in terms of supplementation. When you do surveys of vitamin D or other vitamin supplements, vitamin D usually comes in as either the top or the second place most commonly consumed supplement. It'll either be multivitamins as number 1 and vitamin D as number 2, or vice versa. So it's a very common supplement, and there are very good reasons for this. There is one vegan source of vitamin D3. So I just mentioned vitamin D3 is typically from animal sources, but we recently discovered that An organism called lichen, which is a symbiotic organism made of fungi and algae, is a source of vitamin D3 that is vegan. And it's the same vitamin D3 as you find in the animal products, has the same bioavailability, and it's also sustainably harvested. So this is really a wonderful, remarkable discovery, and it opens the door for us to use this lichen-based vitamin D3 in our supplements, thereby increasing the accessibility to people who don't want to consume animal products like vegans. I mentioned that foods have a very limited source or reservoir of vitamin D because evolutionarily speaking, we have another route that we get vitamin D through, and that's from sun. So we have this beautiful relationship with UVB light, so ultraviolet type B light from the sun. When it hits our skin, there's a precursor called 7-dehydrocholesterol. It's a cholesterol derivative, and it gets converted into pre-vitamin D. Pre-vitamin D then gets converted to vitamin D3 through body heat. Vitamin D3 is not, in fact, the active form of the vitamin in our body. That's the vitamin D3 form, but in order to get it to do its jobs, has to go through two additional chemical reactions. So the first one happens in the liver. It is called a hydroxylation reaction. That's just the chemical name for it. It's not really that important, but what I want to point out to you here is that this 25-hydroxyvitamin D3 that gets formed, this is the form that gets measured in your blood if you take a blood test. So if you go to your doctor or you do a home test or your naturopath and they want to measure your vitamin D levels, they're not measuring vitamin D3 or pre-vitamin D3. They're not measuring this last active form either. They're usually measuring 25-hydroxyvitamin D3. This is our stable form, and it's also the storage form of the vitamin. Now, in the kidney, we have a final reaction, another hydroxylation. It converts it into this 125-dihydroxy vitamin D3. Don't worry about the name, but the point is, this is our active form. This is the thing that does all of these really cool actions that we're going to talk about very shortly. But the point is, we don't measure 125-dihydroxyvitamin D3 because it doesn't stick around for very long. It gets kind of made on an as-needed basis. So you can see here that we have a beautiful, complicated system whereby we can take vitamin UVB light and make vitamin D actively in our body. And this historically has been by far our main route of exposure to vitamin D. What does it do in our body? It does all kinds of things. Now, if we were to rewind 50 years, even 30 years, most people would have told you that vitamin D just needed for bone health. That's all it really does. And of course, it was really important for bone health. We recognize that importance in early studies of deficiency, where you saw increase of fractures, children being born with rickets, deformed bones. So we know that vitamin D is extremely important for bone health. But since then, we've discovered that it actually does way, way, way more. And I would argue that some of these other roles are just as important, if not more important, than the role of maintaining our musculoskeletal system. We know that vitamin D is now a critical regulator of the immune system. And the immune system is going to be obviously what we use to fight our invading microorganisms, but it's also regulating our inflammation. It's also involved in protecting us against cancer. We know that vitamin D protects against oxidative stress. And recently, we're really realizing that it has a really important role in supporting brain function. So you can see that it has very complex and multifactorial roles in the body. It is a really interesting and important vitamin. So how much vitamin D do you need? Oh my goodness, this is a complicated, controversial topic. So whenever we look at nutrients, we get these recommendations from the Institute of Medicine. And the recommendations give us what are called dietary reference intakes, where you sometimes get something called an RDA, a recommended dietary allowance. And this is the amount that is recommended officially. These are your government recommendations that everybody should consume. Often they're broken up by certain age groups, sometimes by gender in different states. But the point is that that is the amount that the government is telling you you need to consume, and this is an important fact, to avoid deficiency. These numbers are not to optimize health. So for some nutrients, there's not a big gap between that avoidance of deficiency and optimizing health. But for vitamin D, this gap looks like it's really, really big. So our official recommendations for children up to 12 months is 400 international units. For people aged 1 to 70 years, it's 600 international units. And for people 70 years and above, it's 800 international units per day. So those numbers, in contrast to the amount that you will make with total body sun exposure for about 30 minutes at peak times in the summer, you're going to make between 10,000 and 20,000 international units. So you can see that there is a very significant discrepancy between the amount that you would make from the sun versus the amount that you're being recommended to prevent deficiency. And so this has yielded an enormous amount of controversy between experts working in the same field, controversy between doctors and scientists. But what you do see when you look at the literature and you kind of put everything together is that often what is recommended is a range of intake between 2,000 and 5,000 international units a day. Many, many factors influence vitamin D levels. It's actually difficult to make a blanket recommendation because there are so many things that are variable between different people. One of the biggest ones is body weight. So if you are overweight, especially if you are obese, your vitamin D requirements can increase twofold. If you have gut issues, that means you're not absorbing your nutrients well. You can have a dramatically increased need for vitamin D simply because it's not getting from the GI tract into your body. Genetics, we're realizing, play a huge role in people's vitamin D status. Remember I said that you have to go through many steps in order to get to that active 125 dihydroxy vitamin D. That's the same no matter whether you're getting it from sun or from supplements or from the diet. So genetics play a role in that process of making the active form of the vitamin, and some people just don't do it very well. So this genetic component is another inter-individual characteristic that we need to take into consideration if possible. Skin color is another factor. Darker skin in exposure to the sun limits the synthesis of vitamin D, and then seasonality. So for somebody like myself who lives in a northern climate, I have very, very, very limited synthesis of vitamin D from the sun simply because of my geography. So all of these factors are things that people really need to think about when they're considering how much vitamin D do they need on a daily basis. In terms of deficiency, we know that vitamin D deficiency is very prevalent. Where the arguments come in is how prevalent. And this is because of the issues that we have with figuring out what our cutoff is for deficiency. This is not agreed upon. We have many different medical organizations that have set different standards, and so we're left in a little bit of a gray area. What we do know is that if we simply look at those intakes from food and we use those government recommendations, which remember I said are pretty low, we see that 92% of men, 97% of women, and overall 94% of people over the age of 1 do not consume even that low amount of vitamin D from food. Now, we have upwards of 20% of people who supplement. That level of supplementation brings up that daily intake. But the supplements really vary. Some of them contain 200 international units, some of them contain 5,000 international units. There's enormous variability. But the point is, vitamin D deficiency, no matter what the cutoff is, we know it's very common. In fact, we know it's extremely common. Increases in deficiency are seen in those populations that I just mentioned, people living in northern latitudes, people who are overweight or obese, people with darker skin, people who are vegans, consuming a vegan diet because they're limited in the natural food sources, people with malabsorption, and also those who have gone through bariatric surgery because of the changes to the GI tract. Consequences of vitamin D deficiency are very significant. Everything that's listed here has been validated in scientific research. So what we've seen are a loss of calcium from the bones, which increases your risk of osteoporosis and fractures. We have effects on the skeletal system, or the muscular system as well, increased risk of falling with vitamin D deficiency, increases in markers of inflammation throughout the body, increased risk of autoimmune diseases like inflammatory bowel disease, increased susceptibility to infection. It affects your teeth because there's a relationship obviously with the health of your bones and your teeth, so an increased risk of dental caries. Increased risk of cancer, and this is not consistent across all studies or consistent across all cancers, but it certainly has been observed in the literature. Overall, an increase in oxidative stress, which we know is a risk factor for all chronic diseases and aging, and then also an increased risk of brain diseases like dementia and depression. Many studies have looked at what happens when we supplement with vitamin D. The studies are complicated by the facts that they use different forms or different levels of vitamin D. They use different baseline populations. Sometimes the people who are starting the study are deficient, sometimes they're not. So there are a lot of complicating factors, but yet we still do see very consistently that there are benefits to supplementation, including reduced infections, reduced cavities, reduced incidence of certain cancers, reduced depression, improved insulin resistance or reduced insulin resistance, and decreased inflammation. Things that improve include bone mineral density, memory, and glycemic control. So we have really an abundance of supplementation research that does support the use of vitamin D supplementation for optimal health and wellness. Now we're going to switch gears and we're going to talk about vitamin K, go through all the same basics, and then we'll bring vitamin D and K together. So vitamin K is really a much simpler story than vitamin D. We have two forms of it. We can get it from food, and the food sources of vitamin K1, that's our plant-based source. We call it phyloquinone. We get it from things like leafy greens and seed oils. And then vitamin K2, we call that menaquinone. And it's found in animal foods, but it's also found in bacteria. And it's actually the bacteria in these animal foods that give us the vitamin K too. And what's kind of similar to vitamin D is that in humans, we had vitamin D that could come from food and also had this external source from sun. Here we have vitamin K that can come from food, but it can also come into our body through synthesis in our intestinal bacteria. The problem is the intestinal bacteria does not make enough to meet our needs. It especially does not make enough to meet our needs when we have gut dysbiosis, which is actually very common today. So vitamin K2 is the one that is the more bioavailable. It has many different subforms. They're subdivided into MK4 all the way to MK13. Not really important, but what I do want you to understand is that dietary supplements usually contain vitamin MK4 or vitamin MK7. MK4 occurs naturally in foods like liver and cheese and butter, whereas MK7 is made through fermentation, specifically the fermentation of soybeans, which are called natto. So fermented soybeans are an amazing source of vitamin MK7. And MK7 is more bioavailable than MK4, although both of those forms are more bioavailable than MK1. Vitamin K has some overlap in terms of what it does with vitamin D in the body. For example, it helps to maintain bone health, it decreases inflammation, protects against oxidative stress, regulates the immune system, and regulates glucose and insulin metabolism. It does this in some slightly different ways, but it has overlap and it works synergistically with vitamin D in these areas, but it has a unique role in regulating blood clotting. It's needed for the proper formation of proteins in that clotting cascade. So if you're deficient, you can end up with clotting disorders. Vitamin K, we have an official recommendation in the same way that we do for vitamin D. It's 120 micrograms a day for males, 90 micrograms a day for females, and this is age 19 and above. And if you have gut issues where you don't absorb things as well, especially because this is that fat-soluble vitamin, then we have an increased need. Vitamin K deficiency is not common. So most people do seem to get enough vitamin K, but there are instances where we see increased rates of deficiency. Elderly is the biggest population. People who take blood thinners, people with malabsorption disorders, anyone who's got gut issues, so antibiotic use because it destroys many of the bacteria in the gut that are producing vitamin K, and then anybody who's had bariatric surgery is going to have really blanket nutrient deficiencies across the board that they have to compensate for. Consequences of deficiency of vitamin K are an increased risk of osteoporosis, those bleeding disorders, which I mentioned, increased risk of diseases with an inflammatory component like diabetes, and an increased risk of cardiovascular disease. So even though we don't see a lot of vitamin K deficiency, there have been a few studies that have looked at supplementation, and they've been quite positive. So it's been observed in clinical research that if you supplement with vitamin K, you may have an improvement in diabetes, reduced diabetes rates, decreased inflammation, and decreased risk of cardiovascular disease. And then on the other side, the improved side, we have improvement in glycemic control and improved neuropathy or neuropathic symptoms. So why do we take these two together then? I've made the case, I think quite convincingly, that vitamin D is something that most people probably need unless you're out in the sun on a daily basis where you have warm weather and high sun exposure all year long. Most of the rest of us really are in a situation where we could benefit from at least a little bit of vitamin D supplementation. But I also said that most people are not deficient in vitamin K. So why do we take the two of them together? Great question. And we need to understand that they work together synergistically. So vitamin D, what it's doing in the intestines is it's helping to upregulate increased calcium absorption. What vitamin K does is it helps with that calcium utilization. It helps get that calcium that you absorbed from the gut to where it needs to go. So you can see I'm drawing a picture here between calcium, vitamin D, and vitamin K. They're all interrelated, and the relationship is quite complex, but we can look at it in these very simple terms and say vitamin D increases our uptake of calcium, vitamin K makes sure that that calcium gets to where it's supposed to be. Because without that, vitamin K is that last step of distribution to the optimal places, meaning our bones and our teeth. We can have deposition of the calcium in our soft tissues like our arteries, and then we can end up with cardiovascular disease or atherosclerosis. So it's just important that we take these two together if we're going to be supplementing with vitamin D. And of course, the question to ask then is, well, can I take too much? If I'm going to be supplementing, can I take too much? Especially vitamin K. I mean, I just said that most people take enough of it already. Why do we need to take more? And if I do take more, is there an issue? So for vitamin K, there really literally is no recognized upper limit. You can increase your intake without any negative symptoms. Vitamin D excess is often talked about, and it's often talked about in very dramatic terms. It is very, very, very rarely seen in practice. So even though 10,000 international units is set as an upper limit, there is absolutely no evidence of concern at 10,000 units a day, upwards of 50,000 units a day. And if someone is taking 50,000 units a day, you won't even see harm unless that happens and it's consumed over a long period of time. So the long and the short of it is that for most people, supplementing, using doses that are as recommended will not have issues with vitamin D toxicity or with vitamin K toxicity. So I've set the stage then for this deficiency of vitamin D that we need to address, that we take the vitamin D with vitamin K. And so what is our solution then? Well, of course, our solution to this deficiency state is supplementation with ideally the forms of the vitamins that are the most bioavailable, vitamin D3 and vitamin K2, and the daily regular supplementation with these two fat-soluble vitamins. That brings us to the next part of our discussion today, which is about fringe vitamin D K mix. Why is fringe vitamin D K mix a good choice for you to address this deficiency state? And this is a really important question to address because of all the supplements that are out there, there's probably more vitamin D supplements than there are of any other kind. So it's important to understand how you can look at the different attributes or characteristics of different supplements to make the best choice for your health. So fringe vitamin D K mix is a blend of vitamin D3 and K2. It's a powder. It dissolves in water. It is naturally sourced. It has clean ingredients, and it's part of Fringe's Essentials Supplements line. Our ingredients are always characterized in all of our supplements by 5 attributes, and we are committed to these for our customers at all times. So number 1 is that we have very simple formulations. We don't put into our supplements anything that doesn't have to be there. It's playing a role if it's there. You can be sure of that. We use clean and natural ingredients. So whenever possible, we're using non-GMO, organic, and naturally sourced ingredients. Our levels are effective. So there are many, many supplements out there that use very small doses of the nutrients that are present. Often they're not present in effective or therapeutic doses. All of our supplements, particularly our vitamin D K mix, has the levels at an optimal range for your health. Transparency is really important to us. We don't include anything in our supplements that isn't on our labels, and that you would not think should be an issue in this industry, but it is. Lastly, we are committed to testing everything for safety. So we send out our supplements for third-party testing on every batch, and we do the most comprehensive analysis possible, as we're going to look at in a few slides. So what's in it? Our active ingredients. We have 2 active ingredients, vitamin D3 at the level of 2,500 international units, and vitamin K2 at the level of 130 micrograms. So this may ring a bell to you. We've got our vitamin K2 in at that official recommended daily intake. And then our vitamin D3, we're obviously significantly above that, but we're in that range that I mentioned is what's often recommended, between 2,000 and 5,000 international units. Where we are extremely unique in this market is that our vitamin D3 is vegan. So if we look at the vitamin D3 supplements that are currently on the market, almost all of them are animal-based. They're not vegan. They are derived, the vitamin D3 is derived from sheep's wool, where you have a waxy substance called lanolin. So the sheep's wool is removed. It is exposed to UVB light. It makes vitamin D3. It goes through a chemical processing. And then on the end of it, you can extract and then purify that vitamin. So it's a very unique attribute for our supplement that makes us accessible to everybody. If you're a vegan, if you're non-vegan, you are able to safely consume Fringe Vitamin D supplement, which is derived from lichen. And we have that bioavailable form. So we're not limiting people to having to take vitamin D2 if they want a vegan source. Our vitamin K2 is also vegan. Of course, it wouldn't make sense to make a supplement that didn't have both sources vegan. So our K2 is the MK7, that super bioavailable form of vitamin K2, made from fermented soybeans, called natto. And this form of the vitamin, when you look at how long it exists in the body, it has a nice long half-life, so it doesn't get metabolized and lose its activity, and it's also effective at lower doses. So in terms of our inactive ingredients, here's our limited list of clean, naturally sourced ingredients. We have non-GMO chicory root inulin. So chicory root inulin is a prebiotic fiber. Prebiotic fiber means that it's a type of indigestible carbohydrate that helps to feed the microbes in the gut. So this ingredient helps us with getting accurate dosing, but it also has a functional effect in terms of supporting gut health. We have non-GMO MCT, medium chain triglyceride oil. This is just a quick, clean energy source. We have non-GMO licorice extract, which has anti-inflammatory properties, and then vitamin B8, which is also called myo-inositol, which supports metabolic and hormonal health. And that's it. So simple formulations, clean ingredients, and transparency. So one of the other really unique attributes of Fringe's vitamin DK mix is that our mix is water soluble. So if we go back to the beginning of our conversation, I told you about how vitamins are either water soluble or fat soluble, and the difference is in how they're absorbed, with fat soluble vitamins being more difficult to absorb, water soluble being more easily absorbed, and that bioavailability being higher when they're water soluble, so they get to our tissues more readily. So what we've done here with a little bit of chemistry is to convert fat soluble vitamin DK into water soluble. So it's absorbed more readily and then more of it gets distributed to the tissues. And you can see that illustrated on this graph here. So what you see with the red line, this is a vitamin D3 oil, which would have come from sheep's wool lanolin. And then we have our vitamin DK. This is just vitamin D concentration, but it's the water-soluble mix. And what you can see is that the concentration very rapidly reaches about twice as high. So if we put this into context of comparing a water-soluble vitamin DK mix like the one that we make as compared to a fat-soluble vitamin D3 supplement, you can see that a 2,500 international unit dose would be the equivalent of around 4,000 to 5,000 international units of a oil-soluble vitamin D3. So the point that I'm trying to make is you can take less. You don't need to take as much of the water-soluble in order to get the same amount to the tissues. Our vitamin D content in this range of 4,000 to 5,000 equivalents of vitamin D3 oil is not too low, it's not too high. It's really just right for most people. So the existing market, if we look at our competitors, almost all of the vitamin D3 that's out there is animal derived. And if it is a vegan vitamin D supplement, it's a D2 form, and that D2 form has much lower bioavailability, which we don't want. You have to take a lot more of it in order to get the same effect. Our vitamin K in the existing market, well, sometimes it's vitamin K1, sometimes it's MK4, which is less bioavailable. And of course, when we have this combination, our combination DK products, almost always they're in that oil-based format, which makes them less bioavailable overall. So we really have some significant advantages with our Fringe Vitamin DK water-soluble vegan formulation to our competitors. It's important to point out what we don't include in our supplements. We've talked about what we do include, but now let's talk about what we don't include. We don't include citric acid. We don't include sugar. We don't include stevia. They're gluten-free. We don't use GMOs. We have no dairy, soy, or protein. And this is very unique. We do not have natural flavors in any of our supplements. We do extensive safety testing. So we test for molds, mycotoxins. This gives us a total microbial count, coliforms, E. coli, salmonella, yeast and molds, and Staphylococcus aureus. We test for pesticides, 59 of them in total, and we do very comprehensive and very careful heavy metal testing, including arsenic, cadmium, mercury, and lead. All of this is done by a third party, so it's unbiased, and we test every batch of our supplements. So if you buy one of our products, all you have to do is scan the QR code, and it will bring you to the certificate of analysis that shows you and affirms the safety of the product that you are consuming. So how much should you take a day? In terms of vitamin D supplementation, this is one supplement where we do recommend that in order to know what's optimal for you specifically, that you do test your blood levels on an annual basis. You can do these with an at-home test, or you can do them through a healthcare provider. That will help you to know if you need a little bit more than is recommended, or perhaps even a little bit less depending on what your lifestyle may be at the time. But for most people, mixing 1 scoop a day in water or your beverage of choice is ideal. It's also safe for kids, so we just reduce the dose. Between ages of 2 to 8, we recommend 1/3 of a scoop. Between the ages of 9 to 12, 1/2 a scoop, and a full scoop for people aged 12 and over. And that brings us to the end of our discussion today. If you have any questions or want any more information about our Fringe Vitamin DK supplement, please feel free to reach out to our customer service. We love hearing from you. You can also visit our website at www.fringeheals.com and look at our products. We have a lot of blogs and research that we discuss, and you'll be able to learn a lot more about the products if you're interested. Thank you for your attention.